Welcome to another episode of the Bleeding Edge of Digital Health. Really excited about today's guest. We've got Stephen Charlap. Stephen, how are you today?
I'm doing well. How about yourself?
Fantastic. Appreciate you joining in. So you're founder and CEO of Soap Health. I'm going to go to the notes here because I don't want to get this wrong. It's an EHR integrated AI powered animated digital human with a 100% voice based platform or interface. Is that correct?
Well, that's part of it.
Okay. Okay. Well, definitely want to hear what I missed there, but why don't we start with just kind of I'd love for you to tell the audience kind of what the inspiration for creating the company was and kind of how things got started.
Sure. So my brother was a great doctor loved by his patients. He was even a better brother with whom I shared a room growing up. He would play with me. He would mentor me. He would buy me birthday gifts. He would even let me put my head on his lap during long family hot car rides. Our relationship changed when he was misdiagnosed with a very late stage cancer, and I became one of his caregivers. That was the inspiration to develop Soap Health so that no one else would ever have to go through what I went through and what my brother went through and what his wife and his children and his grandchildren went through by losing him.
Wow. It's a touching story. What was it after I'm assuming he passed away and it was after that you kind of started thinking through autopsying what happened in that situation in your own mind and trying to think through where it went wrong, how he got misdiagnosed. What was the process there?
Yeah, so without going into family detailed confidential medical history, there was a cause of my brother's cancer, and it was something that should not have caught his doctors off guard, but it did. And so after he passed, I spent 3.5 years at Stanford, 1 year studying, 1 year part of a research project that looked at whether Stanford doctors know how to do proper risk assessments, and they did not. And then the third year, Stanford gave me a grant to build one of my early prototypes. And then I left Stanford and I spent 2 more years at Harvard as a visiting scientist, where I did a small pilot funded by Harvard that demonstrated that the idea I had for addressing this problem was a viable idea. And then I started Soap Health.
Well, it definitely sounds like good most good founders do. It sounds like you spent a considerable amount of time isolating the need in the marketplace and the problem you were trying to solve for during that time at Stanford and the time at Harvard. What was the the primary problem you were looking to solve?
So many diseases are initially picked up in the primary care setting. And so primary care doctors, one, need to be able to recognize tens of thousands of diseases. Yes, mostly they see common things over and over again, but every once in a while, a zebra comes in the door. And they need to be able to recognize that as well as a horse. And so what I learned was that there are so many pressures on primary care physicians today: time pressures, knowledge gaps, decision fatigue, cognitive bias, distractions, the wrong financial incentives, shortages, etc., that the error rate has now been determined to be somewhere between 5 and 15%. In fact, our National Academy of Medicine now predicts that every American will experience a diagnostic error. And a Johns Hopkins report just last year reported that 375,000 people die every year from a misdiagnosis, with another 400,000 developing permanent disabilities. So it became very clear to me that this problem needed to be very well understood. Why do doctors make mistakes? What can be done to prevent a mistake? What can be done to get doctors to embrace a solution that can help them be better diagnosticians? Because for doctors, many believe that they are excellent diagnosticians, So they believe it's other doctors making the mistake. So you can't just simply solve the diagnosis issue without offering additional benefits beyond that to get them to embrace a new technology.
And let's jump into the tech a little bit. Tell us about the solution. Yeah, obviously it's an animated virtual assistant, medical assistant. But walk us through kind of the capabilities of the technology. How does it function? What's the target market? Is it just primary care? Is there an application for the emergency department, specialty, et cetera?
So this application has broad usage. Uh, what you're describing in your introduction to SOAP is really just one part of the application, which we call the perfect medical interviewer. It is a patented, clinically validated, and market deployed animated digital human character that is able to collect, based on a mountain of science, more truthful information from patients. Why more truthful? Because it's been shown that the brain reacts differently when you speak to a digital human than a human, and therefore you are more likely to answer a question truthfully. A study 2 years ago showed that more than half of Americans lie to their doctors about things that might embarrass them.
Yep.
And also with a digital human, you don't need to make a good impression or manage your reputation. So studies show not only are you more truthful, but you're more likely to speak more words to a digital human than a human, particularly since a digital human won't cut you off. The second thing we built is called RiskView, the world's most comprehensive risk assessment. Now, why is that important? The two most commonly misdiagnoses are early cancers and heart disease. They initially present with very subtle symptoms, easy to be missed by the best of doctors. A risk assessment says this patient is at increased risk for a particular disease. That additional knowledge has been shown in malpractice literature to improve diagnosis. And so we built the world's most comprehensive risk assessment, and we have a patent pending on combining risk assessment with symptom assessment. We then take all the information we collect, which includes 3-generation family history, social determinants of health, mental health, lifestyle, sexual practices and preferences, history of abuse, with all the regular medical information, such as chief complaint, history of present illness, past medical, surgical, injury history, medications, allergies, etc. And we feed it into a carefully honed large language model where we have worked with 9 of them and now working with the 2 top ones that we decided were better than all the rest to identify a list of potential diagnoses. And then we feed that information back into the model to identify additional information required to narrow down the diagnosis, including test recommendations, etc. Once all that information has been processed, we create what we call the smart SOAP note, which delivers the information to the doctor in a format that's easy to read. Now, why is that important? Because doctors told us that when they get pre-collected information from patients, they don't read it word for word. They scan it with their eyes and they admit it, that they miss at least 40% of what's written. So we deliver the information to them in a much easier to understand format. Easy to read, easy to edit, easy to annotate. And then it rolls up into a traditional SOAP note, and we have the world's most extensive full integration with Athena Healthcare, where we are pushing discrete data into discrete data fields. There are very clearly defined benefits of what we have built.
Yeah, I definitely I mean, just speaking as a patient, I can tell you that, it is, there's things that you're talking to your physicians about that, are sensitive and they're uncomfortable, and it's not so much that you care that they know, it's that those things might be hard to say. And so saying that to a virtual assistant and having that transcribed and manipulated with the data and assessed with the data, and then, giving that to the physician in an actionable insight and a digestible insight makes perfectly good sense. What what are where's obviously primary care is a huge application for this. Where else could you see it being deployed?
Internal medicine subspecialties, cardiology, gastroenterology, rheumatology, neurology, etc., gynecology, family medicine, pediatrics, any specialty that wants to get to know its patient well needs to create what we call a precision patient profile. Patients are affected by social determinants, by environmental influences and exposures, by their occupational history. Knowing this information allows a doctor to zoom in a more precise and personalized way with whom they are dealing with to provide more specific and accurate care. That's what we're focused on, giving doctors superpowers to make them superheroes to their patients, to catch diseases earlier where intervention is less invasive, less life-threatening, less expensive, more effective. That's our goal.
Yeah. And you mentioned less expensive. Can tell us a little bit about some of the financial impacts of this technology? I mean, um, I would think the introduction of a technology like this would have an impact on liability. I would think it would also have an impact on reimbursement. I'm sure you guys have taken a look at some of those items.
Yeah, well, let's start with from a clinical perspective. Lung cancer, identified when the patient is still asymptomatic, cost about 10% of what it costs to treat once it's symptomatic. And two, survival is 10x greater when caught when symptomatic than when caught in a later symptomatic stage. From a doctor's perspective, us catching medical complexity that they miss not only improves patient care, which ultimately saves money because earlier interventions are typically less expensive, as I gave an example with lung cancer, than later interventions, but generates more money for the doctor during that visit because they are spending more time with the patient, dealing with more complicated issues, finding a solution. And I'll give you a quick example. Patient comes in complaining of stomachache, okay? That's probably what's called an evaluation management level 3 code. Run-of-the-mill stomachache could be a virus. But if the doctor also identifies that that patient has a family history of something called Lynch syndrome, which is a cancer syndrome associated with a specific genetic mutation that predisposes people to developing colon cancer before the age of 40, and the patient is a 35-year-old otherwise healthy male, now the doctor must consider that there may be something more nefarious going on, and therefore can bill at a higher level because there is more work to be done, but it's good for the patient, it's good for the doctor to avoid malpractice, discovering the disease earlier, it's good for the payers to intervene earlier. It's a win-win-win for everybody. Early detection, like an ounce of prevention is worth a pound of cure, pays for itself over and over again.
Yeah. What's the commercial status of the technology? Have you guys rolled this out? I mean,
We
I've
have
got
rolled it out. We have over a dozen customers already. Just started rolling it out not that long ago after full integration with Athena Healthcare. So we're particularly focused on Athena Healthcare. We're now doing eClinic Works integration as well and looking at a couple of other EMRs. We're being very painstaking in our rollout. Okay, the first rule of medicine is first do no harm. This is why, almost as a contrarian, I had built something that was meant to be exceptional from the get-go. No MVP was ever put out there other than for piloting research purposes. Patients are too important to experiment on. And so we waited till we built something that not only could do a comprehensive interview the first time, but would remember the patient and follow up the second time with appropriate questioning. So the first one is an exhaustive interview. The second and subsequent interviews are merely fine-tuning and tweaking the patient's information to make sure that the doctor knows everything going on in the patient's life, including the patient sharing information such as their dog died, which for some people could cause significant depression, or to know that they're getting divorced, or to know that they're leaving the practice because they're moving. These are things that a doctor should know about their patient.
Hmm. Yeah. Yeah. And, there's, there's bias on both sides. The patient's biased in what they tell the physician's biased in what they hear. But second component of that is that the physicians just don't have the time to go through this. That's the big thing. Is I think if you polled ten physicians, every single physician would say that they got into medicine to be able to practice medicine that way, but it's just not a reality anymore. The way and you alluded to that in the beginning of the conversation, that the financial incentives aren't structured to drive that behavior. But if you can automate that, then you get the best of both worlds.
Right.
You get
Look, it's not only an issue of how good physicians are, there's also an issue of 100 million Americans who don't have access, according to the National Association of Community Healthcare Centers, to a primary care physician. And with primary care physicians retiring in record numbers, and many of them switching to a concierge practice, which cuts out up to 80% of their existing patients, leaving them searching for a replacement, we have a significant shortage of qualified primary care doctors. We have allowed nurse practitioners and physician assistants to take on more responsibility. There's now talk about letting pharmacists prescribe. Several states are allowing foreign medical school graduates to practice without doing a residency. I believe that given the current state of AI, not the future state, the current state of AI should be a must-have in clinical practice to provide the best possible care to patients in this day and age. In fact, I just wrote an opinion piece to be submitted to publication why we need an autonomous AI-powered primary care provider today, and why it can meet regulatory and liability and clinical requirements without threatening the livelihood or displacing physicians from doing what they do best.
Yeah. What from a technical perspective, how does the platform sit? Does it sit? Is it cloud native? Is it
Cloud-based, it's high security. It is triggered by a patient scheduling an appointment. They get an email or text with a link. They click on the link, they authenticate themselves, they consent, and they're having a full-blown voice-based conversation with an animated character. So for example, most systems say, what's your name? And you say, my name is Dr. Charlap, but you can call me Steve. They will say, hello, my name is Dr. Charlap, but you can call me Steve. Our system will prune out Steve and say, hi, Steve, how are you doing? That's
wow,
the level of capability that we've gotten to.
that's incredible. You're definitely creating a buzz out there. I think I told you this when we first spoke. Um, you were independently referred to me by two people I don't know who listened to the show, who said you really should consider this as a feature for the platform. Um, and I don't get that very often. We get referrals here or there, but two people within the span of a week, which is what led me to reach out to you. Is there anything else out there like this? I know there's a ton of AI platform. We interviewed a company, RadOS is the technology, Serona Medical. We interviewed them yesterday. That's kind of a redesign of the operating system that radiologists use. The guest had said exactly what you said a minute ago. He said physicians in this day and age with the capability of AI, physicians have to be using it. And if they're going to be using it, they have to use it in the most efficient fashion possible in order to really extract the potential benefits from it. Is there anybody else out there that's doing anything like this?
Not even close, which is why we got a large contract from the National Cancer Institute to improve cancer risk assessment in the primary care setting. Why us and Imperial College, who's the lead investigator, just got over a $3 million grant in the National Health Service of the United Kingdom, also to improve early cancer detection. Again, cancer is the second most powerful killer, but is the singularly most missed early disease in the world. And so even not internationally now, what we are building is recognized in a class of its own. And again, we have a patent issued, patents pending on the very unique thing that we have built. Now, because I'm on a personal mission to save lives in memory of my brother, my personal goal is to price this as low as possible so that everyone on the planet can afford it. And consistent with that, I don't take any compensation. And I have given my stock to my children because this is a mission to save lives and prevent disabilities, again, in memory of a just incredible older brother.
Yeah, that's a really, really touching story. You mentioned cost. How do you price it? Is it a subscription model?
It's a
Can you?
subscription model per physician, and we expect physicians to make several times over for what they pay us. In fact, we were at a conference where I was telling physicians they would make 500% return, and nobody was taking me seriously. But the reason I could offer a 500% return is because I really believe there's a 1,500% return on the use of this application. It simply makes doctors better versions of themselves, more efficient, more productive, more knowledgeable, more capable. A doctor that doesn't embrace SOAP health is doing a disservice to his and her patients. Again, this was built over 9 years, and in terms of what it would cost US engineers to build this cost over $14 million to build.
Yeah, I believe it. I believe it. I want to be able to, I know, get you out of here on time. Last question for you. What's next? What are you guys adding? Any additional products to the company, or any additional features that you're targeting to roll out?
We are. By September, we hope to complete the world's first AI-powered primary care provider. It will give, again, doctors all the help they need, including interviewing the patient, performing risk and symptom assessment, identifying what testing, if any, is needed to narrow down the differential diagnosis, process the test results, narrow down the diagnosis, making it easier to pick the right diagnosis the first time, and recommending treatment. It will do everything a doctor does other than the physical exam, but the physical exam done by the doctor will also be fed in the model to narrow down the diagnosis.
Wow. How do you that's incredible. How do you prove that out?
One, we've taken real world case studies and we've tested our model against real world case studies and have got top of the line results, again, slightly better than the Mayo Clinic.
Wow.
Two, I want to challenge real doctors and every company out there that says they have a great diagnostic tool to the Great Diagnosis Bake Off, taking real patients and comparing what we built to anybody else, including the Mayo Clinic, which believes it is the epitome of diagnostic capabilities. People travel from all over the country and the world to get the right diagnosis from the Mayo Clinic. We believe we can do just as well, if not potentially better.
Wow. That's exciting. I'll be looking forward to seeing, following up with you and seeing the results of that. And you believe that that'll be launched sometime in September?
Correct.
Wow, that's amazing. Really impressive. Very, very heartwarming story. I know your brother's got to be extremely proud of you and looking down fondly on what you're building and the impact it will have on millions and millions of lives. Obviously, have the applicability here in.
Billions of
Yeah,
lives.
yeah. I was just going to say the applicability here in the United States, but there's really no scalability issues. I mean, with a few deviations and
Yep.
changes, you could roll this out worldwide. It's really impressive. Thank you for coming on the show, and for taking the time to share what you guys are building, and definitely down the road as things continue to evolve, I'd love to have you back on the show for an update.
Okay, well, thanks for having me. And if any of you listeners want to reach out, my email is my first initial last name at soap.health. So happy to collaborate with anybody that shares the mission of wanting to save the lives of people you will never meet. So thank you.
Thank you. That's it for this edition of the Bleeding Edge of Digital Health. We'll catch you on the next show.